I'm going to walk you through exactly what I'm doing to fix my wrist while preparing for my next competition. Welcome back. Part 2. Today we're going to figure out how to actually make my wrist feel better. So, the most important things for actually healing are, number 1, of course, rest. So getting proper sleep, getting proper nutrition. Without those, you won't heal. Or if they're suboptimal, you will heal suboptimally. So take care of your recovery, okay? If you need help with that, of course, we can chat more about that somewhere else. But sleep enough, eat good quality foods. After that, taking away the things that are preventing healing. Seems obvious, but people very often will continue to do the things that perpetuate pain or injury. And there's probably all kinds of reasons for this. I've done it before, but that will either prevent it from healing altogether, or it's just going to take way longer if you keep doing those things. So taking away the injurious stimulus. For me, it was mostly shoulder to overhead with a barbell and anything on my hands, mostly like handstand push-ups or handstand walking. So since the last video, here's what I've done. I have not done any shoulder to overhead with a barbell. I've used dumbbells instead, and that was totally fine. We did Fight Gone Bad, and I used 2 30-pound dumbbells, and it went well. Felt totally fine on the wrist. I have been doing front squats and back squats, but front squats have been feeling pretty good. Just trying to keep the elbows up as high as possible and keep the weight on the shoulders, not letting it drop into the arms and the wrists. So continuing to work on front squats. Have done a little bit of push-ups. And just yesterday, had a workout with handstand push-ups, and those are now feeling fine again. It was a little bit sore, particularly in the warm-up, but got better, and then essentially no pain at all during the workout. So, have already started to return to some of the worst things from before. Part of this process will be to continue the assessment as you're working through things. So having those standard movements or standard positions that you test will give you an idea of where you're at and what's a good idea to be doing in your sessions. So for me, that would be an empty bar, shoulder to overhead, get a gauge of how that's feeling. And then anything on the ground, either a handstand against the wall or some push-ups, will give me a pretty good idea of where things are at. Now, to actively work to improve these positions or these movements, the first thing will be to do some repeated joint mobilization. So basically just a repeated dynamic stretch. So first, maybe seemingly counterintuitive, try just repeating the movement that hurts. And you can be gentle with it. You don't have to go crazy. But if you're gentle, you're careful, you're not going to make anything super, you're not going to make anything way, way worse by doing this. But you can get an idea of, oh, it actually is starting to feel a little bit better with repetition. It's loosening up a little bit. Then there you go. There's your first thing. You just need to get it moving a bit more and it'll feel better. So for me, this actually does help, especially if I stretch my fingers, not just pushing my wrist into extension, but actually stretching the fingers into extension and the wrist as well. That really loosens it up. It just popped and now it's already feeling a little bit better. Great. If that doesn't work, or it's getting, if it doesn't really help at all, or it's actually getting worse, of course, you can stop and move on. The next thing to try would be just go in the other direction, right? Try some different movement, okay? This for me actually doesn't make it worse. So going in the opposite direction, no go for me. I like to go in this direction, which is odd because that's the direction that hurts. It's very common. So some repeated movements, okay? Try each direction, right? You can try some sideways movements there. You can try some twisting back and forth like this, right? All of these are options. If it was your knee, you could try extending it like that for repetition, or you could try repeatedly bending it, right? Give it a go, do lots of repetition in one direction, retest your standard movement, okay? So in this case, it would be either like a handstand or shoulder to overhead. See how that compares. If it's better, then you've got your first tool in the toolbox. Use that as often as you need it, probably every day, maybe multiple times a day, probably in your warm-up, and away you go. If none of those just repeated basic movements work, okay, what you can try is to do some little bit more involved mobilizing. So we'll use my example again, getting into that extended wrist position, okay? You could try to change how you get into that position. So first thing would be to try to kind of decompress the wrist and then push into that position. You can need something else to push you in that position because I don't have three hands, but decompressing, so pulling like you're trying to make your arm longer, and then getting that extension. And this I have been doing, and it has helped. And it even will start to kind of crack and pop a little bit. So we know we're getting a good movement in there. That's obviously not necessary. The cracking, popping, not necessary. Just can feel really, really good. And sometimes, and it's definitely a sign that there's movement happening if there's noise. So some repetition just like that. And again, you could do the same kind of decompression with flexion, and that feels way better than flexion without the decompression. So maybe that's another option. And you could even do the side-to-side movements. If that feels kind of hard, you could have a band wrapped around the wrist a couple of times, so it's not going to go anywhere. And have that pull on your wrist into a little bit of decompression. And then move. This one, the setup's a little bit tough, but if you can get it set up nice, have that band pulling, again in that same kind of decompression, like that. And then you can do your wrist movement actively, or if this is wrapped around, you can do it actively and then add the push on there. So some different ways to mobilize the joint on your own. If it was your knee or your hip, you wrap a band around your foot, lay down, have the band wrapped around the rig, pulling your leg into, again, that decompression, and then you try some hip or leg movements. Same idea. So some repetitive movements with or without some decompression or some band kind of traction on the joint can be very, very helpful. So those are some things to actively try to reduce the irritation and just get you right back into these movements quicker. Again, priorities are rest, recovery, put those in place, and taking away the things that are definitely going to keep it painful or make it worse. Those things, after those things, then some of these additional therapies, basically self-treatments, can be very, very helpful. But they will not make up for dog shit recovery or continued aggravation by being stupid, basically. So those are the main things to focus on for actually making things better. keep your ongoing assessment to make sure that you're going in the right direction, okay? On a, it doesn't have to be every day, right? Often, especially at the beginning when things are very, very irritated, I probably wouldn't be testing things every day. If it really, really hurts, don't just keep going in and trying to handstand when your wrist hurts every day. Give it a few days, work on your other stuff, come back, see how it's going. As you get that positive feedback from the ongoing assessment that things are getting better, then you gradually reintroduce the offending movements, okay, with proper scaling. So, lighter or lower volume at first, building the intensity and the volume over time with those previously painful movements. So that's it for today. Next time, we're going to go over progressions, and we will probably touch on auto-regulation in that video or maybe the next one. Stay tuned.